Ladies and gentlemen, good afternoon. Welcome to the press conference of the State Council Information Office to implement the important directives of the CPC Central Committee on COVID response. Today, the Information Office is having this press conference on rigorous COVID response, and we'll take your questions. Today, we have with us Mr. Wang Hesheng, Vice Minister of the NHC and Head of the National Disease Control and Prevention Administration, Mr. Zeng Yixing, Vice Minister of the NHC, and Ms. Jiao Yahui, Director General of the Medical Administration and Management Bureau of the NHC. Now, Mr. Wang, please. Friends from the press, good afternoon. Thank you for your interest in and support for epidemic prevention and control. Let me brief you on the current priorities of COVID-19 response, and then my colleagues and I will take your questions. The CPC Central Committee and the State Council attach great importance to COVID-19 response. General Secretary Xi Jinping personally directed and deployed relevant efforts and made a host of important instructions, emphasizing the need to uphold the overall strategy of preventing imported cases and domestic resurgence, and the overall dynamic zero-COVID policy, and also the need to coordinate COVID response and economic and social development. Yesterday, General Secretary Xi chaired a meeting of the Standing Committee of the Political Bureau of the CPC Central Committee to analyze the COVID situation and instructed on vigorous COVID response. General Secretary Xi emphasized that perseverance brings victory. The regional authorities and government departments must fully recognize the complex, arduous, and enduring nature of COVID control at home and abroad, further mobilize resources, build consensus, strengthen confidence, keep up the hard work, and make meticulous and solid efforts to continue to contain the virus. We'll continue to put people and their lives first, stick to the science-based, targeted, dynamic zero-COVID approach, and curb the spread of the virus as quickly as possible. We need to make our COVID response more science-based and targeted, continue to improve our response measures, maintain strategic focus, seek steady progress, and coordinate COVID response and economic and social development. We will take more effective measures to achieve the best results in COVID containment with minimum costs and minimize the epidemic's impact on economic and social development. The National Health Commission and the National Disease Control and Prevention Bureau have been earnestly implementing the important instructions by General Secretary Xi in response to the multiple local clusters in parts of China. We have worked with relevant authorities to strengthen guidance for key regions to ensure early detection, reporting, quarantine, and treatment, and ensure that COVID measures will be strictly and earnestly implemented. We'll take more effective and targeted steps to effectively control local clusters as quickly as possible and foster an enabling environment for people's life and for economic and social development. First, we'll work swiftly on emergency COVID response. In recent weeks, China has seen local clusters occurring widely and frequently in multiple regions. The State Council Interagency Task Force immediately sent national working groups to provinces including Jilin, Shandong, Guangdong, and Heilongjiang to guide their local COVID response. We have worked with the localities to jointly assess the COVID situation, work out countermeasures, accelerate testing, screening, investigation, and regional checks, ensure early detection, reporting, quarantine, and treatment, ensure sound medical treatment of patients to fully stem the spread of the pandemic. Second, we need to cement the defense against imported cases. We need to ensure sound prevention for people, objects, and environment, step up personnel management at the ports of entry, ensure strict closed-loop management, and increase the frequency of tests. We also need to guard against risks from imported cold chain food and high-risk non-cold chain objects, step up management of the border areas and the ports of entry, clamp down harder on illegal entry, work vigorously to build a joint prevention and control mechanism at border areas with neighbors over land, and jointly ensure sound epidemic control and customs clearance for cargo at the border areas. Third, we need to further enhance our capacity to prevent, control, and handle COVID infections. We'll improve COVID response plans on monitoring, epidemiological investigation, quarantine, medical observation, community response, sample collection, and testing, and ensure those tested positive will be reported and investigated immediately, and that control measures will be in place before screening. We'll also regulate work on the screening of people at risk, management of close contacts, and determination of at-risk areas. We would emphasize both modern and traditional Chinese medicine, ensure sound regulated treatment of patients, and will fully strengthen the responsibility of medical institutions and in-hospital infection prevention and control measures, and carry out records-based management of over 7,000 fever clinics and more than 800 designated hospitals. We will also step up our testing capacity with a national testing capacity of over 40 million per day. Fourth, we need to ensure sound vaccination. As per directions of the Joint Task Force, and following the principle of informing the population for their consent for voluntary vaccination, we have guided the localities to steadily advance vaccination and booster rollout, and to enhance and increase the vaccination rate. The gains we have made in COVID response do not come easily and should be cherished. Going forward, we will work with relevant authorities to implement the decisions of the CPC Central Committee and the State Council, keep strengthening our efforts on the priorities in COVID response. First, we'll bring local clusters under control as soon as possible. We'll guide the key areas to accelerate testing and screening and epidemiological investigation and management of people at risk to achieve zero COVID in the society. Second, we need to firmly guard against imported cases and ensure sound long-end prevention and control before the entry, highlight closed-loop management, expand monitoring of key groups, ensure the authorities at the ports of entry will shoulder their responsibilities and step up patrol and deployment of anti-COVID resources along coastlines and riverbanks. Third, we would step up routine COVID control in key areas, and we would guide the professionals at schools, nursing homes, prisons, and other crowded areas such as transport stations, supermarkets, and also those working on cold chain industry and logistics to strictly implement COVID countermeasures. Fourth, we need to further enhance our science-based and targeted COVID response measures. We need to strictly implement the preliminary checks, triage, and first treatment measures, and improve the early warning mechanism. We would also promote antigen testing and nucleic acid tests, guide localities to treat and respond to COVID cases in a science and targeted way, and minimize impact on economic and social development. We will now open the floor for questions. Please identify yourself before raising the question.
With CCTV, the current round of outbreak is characterized by outbreak in various places, a wide coverage, and a large number of confirmed cases. What is your assessment, and what is the progress of tracing the virus source? What do you think are the reasons? Thank you. Thank you very much for your question. Indeed, as you said, recently we have witnessed multiple outbreaks in various places with a wide coverage. 4 reasons are as follows. First, since December 2021, the global COVID situation entered a fourth wave. There have been 11 weeks in consecutive with over 10 million confirmed cases weekly. The pandemic level globally has stayed at a high level. Since this year, we have seen a rapid increase of confirmed cases in our neighboring countries and regions. So the difference of pressure is becoming more prominent between our neighboring countries and China. In the first 2 months, averagely there have been 91 cases imported daily. This number has been way higher than the 22 cases daily in 2020 and 32 cases daily in 2021. And in March, this number, the imported cases daily, has averagely exceeded 200. Some day even exceeded 300. So the pressure of case importation has been mounting. Second, the Omicron variant, in particular the BA2 subvariant, has been more contagious and less detectable than other virus variants. So it makes us harder to detect and discover the variants at early stages. When they are discovered, they have spread it to quite a wide scope. So it is very hard or more difficult for us to handle the virus. Thirdly, late February was the time when the Spring Festival holiday ended, spring semester began, factory resumed production, which brought a massive flow of population. And also other activities like meeting, training, wedding, and all kinds of ceremonies also magnified and amplified the impact of COVID. Fourth, some may think Omicron variant is not as severe as the previous ones and is no different from flu, so their guard have been lessened. This lower of vigilance has reduced the level of COVID response. According to our analysis, the high pandemic level of the global COVID-19 situation will not end soon. And China will continue to face the situation of multiple outbreaks in various places at the same time with Omicron strain as the main source. The COVID-19 situation in China will be more complicated. And also, epidemiological result has proved that the recent cluster of cases in China are caused by imported cases. And as Omicron leads mostly to mild and asymptomatic cases, so it is harder to detect and discover the source of the virus. And the transmission could be more diverse. In many places, we have discovered many transmission routes at the same time. These features have forced us to increase the sensitivity of monitoring and pre-warning efforts to improve the pre-warning and monitoring mechanism to increase our capacity to detect the virus as soon as possible. Next question, please.
好，那个后面吧，第3排那位记者，靠边上。对。
谢谢。日本共同社提问。我们都知道中国的
We know that China's dynamic zero-COVID policy has been successful. The recent outbreak in various places may restrict China's manufacturing and consumption and make it difficult to communicate with foreign companies. I want to know if the policy will see any changes in the first half of this year.
Thank you for your question. Since the onset of COVID-19, under the strong leadership of the CPC Central Committee with Comrade Xi at its core, China has always put people's safety and health front and center. We have been strengthening COVID response, which has worked quite well, and we have protected people's health and safety to the utmost. The dynamic COVID strategy was made on the basis of preventing imported cases and domestic resurgences, and on summarizing the experiences we have gained. It is focused on early detection of even minor cases so as to swiftly identify those that have contracted the virus and minor outbreaks, so that every case, whenever and wherever discovered, will be stamped out, so as to minimize and bring to zero the number of infected cases. And the goal of this policy is to minimize the social cost and to contain the virus in the shortest period of time. The core about this policy is rapid response, rapid handling, and rapid blockage. It is targeted because the epidemiological investigation, management, quarantine, community control, and treatment will all be targeted. All the measures will be targeted throughout all these links. And we can see that our COVID response has effectively balanced economic and social development and COVID response. We are the world's one of the world's few main economies that achieved positive growth. And this has not come easily, and facts show that our experience in COVID response has ensured our people's safety and health and facilitated economic growth. Well, in fact, COVID has affected to different degrees the economic and social development of all countries. But the different COVID response and measures will have different impact. When assessing the impact on the economy and the cost of COVID prevention, we need to differentiate the different results, which are caused by the pandemic itself, which are caused by economic growth, and which are caused by COVID response measures. We can't just blame all the impact on the economy on COVID response measures. Second, when assessing the effect of COVID response costs, well, in a more scientific manner, we need to look at 4 dimensions. First is the cost and effect of COVID response. In other words, what are the costs, how many infections are prevented, and how many severe cases and deaths are prevented. I believe the concept of COVID response of our party and country is to put people and their lives front and center and to do our best to ensure people's safety and health. So we can see that the overall number of infections, confirmed cases, severe cases, and deaths are quite low. This shows that China's cost and effect of our COVID response is quite high. The cost and effective ratio is quite high. And second is the efficiency. That is the speed at which we deal with the outbreaks. Usually, within 1 to 2 incubation periods, we would rapidly deal with and stamp out the outbreaks. This points to high efficiency. And third is the efficacy of our COVID response. Through the dynamic zero COVID policy and the targeted COVID response, we ensured normal work and life of most of the people in most areas in China. And they also helped reduce the inconveniences caused by COVID-19 and possible mental problems caused by the pandemic. This shows that while sacrificing the normal activities of an extremely small number of people, we have ensured the normal work and life of most regions and most people. Fourth, the outcome or the economic benefits of our COVID response. And we need to look at the larger picture when assessing the effectiveness of our measures. It is not objective to just look at the costs of the places where outbreaks occur. We need to look at the whole country and the entire economic performance of the nation. Facts have proven that the dynamic COVID policy is consistent with China's national conditions. It is science-based. It is the right approach that has worked well. Although the containment measures have had some impact on the work and life of certain regions, but those impact is short-lived and limited. Any COVID response would come with a price, but compared with people's health and safety, those costs are well worth it. And I would also like to thank the Chinese people for their understanding, support, and coordination and cooperation with our COVID response. And China's experience shows that our dynamic COVID policy is the best practice for a huge country like ours with more than 1.4 billion people to guard against risks of COVID-19 and to put people's lives front and center. It is also the biggest contribution to the global fight against COVID-19.
先第一排吧，这位女记者。
谢谢主持人。南方都市报恩视频记者提问，请问当前
Thank you
全
with
国的
Southern
疫苗接种
Metropolis.
情况如何？那么使用
What is the latest update on the national vaccination rollout?
与使用相同技术路线疫苗的
What is the
同源加
difference
强免疫有何差异？
between
那下一
the
步如何实施？谢
homologous
谢。
and homologous schedules of vaccination? What is the next step for implementation?
我们曾益新主任也是我们的科学院院士，由他来回答。
I'll invite Mr. Zheng Yixin to answer this question. Thank you for your interest on vaccination. According to the decisions and plans of the CPC Central Committee and the State Council and the plans of the State Council Interagency Task Force, all local governments are steadily advancing vaccination work. By March 17th, yesterday, over 3.21 billion doses of vaccines have been vaccinated in China, and over 1.27 billion people have been vaccinated. Among them, almost 1.24 billion people have been fully vaccinated, accounting for about 87.85% of the total population. And about booster shot, by March 17th, over 640 million people have received booster shots. In light of China's COVID situation, the need of COVID response, and the research and development of COVID vaccines. Since October last year, the State Council Interagency Task Force started homologous schedule of vaccination, meaning the booster shots would be the same as the ones they received during their full course. And recently, we give further supplement to this vaccination schedule by including heterologous schedule to increase immunization. So the booster shots can be different from the ones they received in their full course. Now we have approved the plan to use adenovirus vector vaccines and recombinant protein vaccines on the basis of inactivated vaccines. And next, in light of our research and development progress, there will be more options. And according to our current policy, for all those eligible for booster shots, they can receive homologous and heterologous schedules of vaccination after 6 months since received full vaccination. And they can choose one from the two. And some are curious about the difference between these two schedules. Actually, there have been studies both in China and abroad about this topic. And the research has proved that both of the two schedules could significantly boost immunity and protection. As I said, over 600 million doses of booster shots have been given. And as this heterologous schedule started a little bit later, so it only accounted about 10% of the booster shots. In terms of adverse reaction, the two schedules, there have been no notable difference between these two schedules of vaccination. We hope that for all those eligible to receive vaccination, in particular the senior citizens and people with underlying diseases, if they're eligible, they could receive vaccination as early as possible. This is not only a safeguard for their own health, but also by doing this, they can protect the whole society. Thank you. Next question, please.
第一排的，这位记者。
谢谢主持人。红星新闻记者提问。
Rest our news.
国家卫健委公布第9版新
The
型冠状
National Health
病毒肺
Commission
炎
announced the
诊疗
9th
方案，
edition
对
of
轻症病
the
人处置
treatment protocol for
核酸检测
COVID-19,
CT 值等
which makes
做出
important
重要调整。
adjustments to the handling of patients
此次
with
修订的
mild
原因是
disease
什么？是否意味着
and
防
others.
控政
What
策
is
放
the
松？
reason for this
各
revision?
地还有
Does it
必要
mean
实行像
the
现在
COVID
这样
policy is
严格的
relaxed,
防
or
控
is
措施
it
吗？
still necessary for local governments to
这个问
implement
题，请我
strict
们
control measures as
两
now?
位局长回答一下。
好，谢谢您的提问。那么首先
Thank you
呢，
for
我
your
想先
question.
明确的回答这个问题呢，就是
To answer your
9版诊疗
question,
方案的修订并不意味
the
着防
revision
控
of
政
the
策的
9th
放松。
version of the
那么
protocol
各
does
地
not
呢，现在
mean the
仍然
COVID
还是要
measures
慎
will
重
be
如实
relaxed,
地做
or
好
the
新冠肺炎疫
localities
情的防
still
控
need to
工作。
earnestly
第一
implement
次呢，我
related
们9版
countermeasures
诊疗方案的
against
修订呢
COVID-19.
是基
The
于
revision of
我
the
们国家呢
9th
2年以来的抗疫
protocol,
的实
the
践。
9th version of the
特别
protocol
是
is
在
based
我
on
们
our
对德尔塔
experience
病
of the
毒
past
和
2
奥密
years,
克戎毒
especially
临床病
on
例的观察
Delta
和
variant
研
and
究。
Omicron
基于这
variant,
个实践的
including
基础上
our
呢，我们对
clinical
9版的诊疗方案
experience and
做出了
assessment.
修订。
So, on the basis of those assessments, we have made revisions to the treatment protocol. The revisions include discovery and report of cases, and we added antigen tests, which will be a supplement to the nucleic acid tests. And when it comes to collecting the patients, we would also categorize them before we bring them together. And in addition, there are also elements about traditional Chinese medicine's role in COVID response and also the management of the patients after they are being discharged from the hospital. And these adjustments are made in order to implement the direction of General Secretary Xi to ensure science-based and targeted COVID response to achieve the best results in COVID response with the minimum costs. So it is based on this consideration that we have made some adjustments to the latest version of the treatment protocol. As for the patients and the categorization of the cases, we have made it clear in the protocol that the minor cases will not be sent to the specialized hospitals. They will be put instead under centralized quarantine centers. For the ordinary and severe cases and also those high-risk cases, they will be sent to specialized hospitals. That means, in addition to minor cases, all those asymptomatic cases will be sent to the quarantine centers. What I want to clarify is that the quarantine facilities are different from the quarantine facilities for those close contacts, because the minor cases and the asymptomatic cases, they tested positive for COVID-19, yet those close contacts do not test positive, so they need to be kept apart from each other. Some localities have chosen specialized quarantine centers for those cases, and for Shandong and Jilin provinces, they have also opted for makeshift hospitals for minor cases. To put those minor cases in the centralized quarantine centers does not mean that we will just let them be. According to the 9th version of the treatment protocol, we would also arrange for some medics and also medical staff for those facilities, which will help provide targeted treatment to the minor cases, for example, coughs, fever, and the clogged noses. And in addition, we would also observe those cases closely. And based on our current practice, more than 90% are minor cases and asymptomatic cases. And there isn't much that can be done at this stage for these cases, but that doesn't mean we will do nothing. We would also put them under close observation to see if there are any changes in those cases. If they become severe cases, they would also be sent to specialized hospitals for treatment. So that is the adjustment we made to the categorization of the cases. As for the standards for discharge or the CT levels, well, in the latest version of the protocol, if the CT level is above 35 and after the symptoms disappeared, if those symptoms have eased, if the cases met all these standards, they could be discharged or be released from the quarantine facilities. This is also based on our practices, which show that for those cases who are recovering, when the CT level is above 35, the active virus will not be separated from them. That means that these cases are no longer transmissible. So those patients can be sent home. And such an adjustment is aimed at making the best of our medical resources. On one hand, we could send cases that really need to be hospitalized to hospitals to ensure effectiveness of our medical treatment. On the other hand, we would also put the medical resources to better use to ensure people's other medical needs can be protected and guaranteed. And such adjustments would help us better implement the principle of putting people and their lives first. As for management of people who are discharged from the hospitals, the period of their quarantine has been reduced from 14 days to 7 days for at-home medical observation. The adjustments at the latest version of protocol does not mean any relaxation of the COVID response. It means we are adopting more science-based and targeted measures to counter the virus.
好，后面吧，第4排这位外国记者。对，后面。
I have two questions. Sorry, one of the biggest ways that dynamic COVID-0 affects the economy is when factories have to shut down and people have to quarantine for long periods. What can the government do to reduce that impact? And do you have any plans to introduce foreign vaccines or other foreign medicines to aid with the treatment of COVID-0, aid with the treatment of coronavirus? Thank you.
好，请翻译一下。
来自彭博新闻社的记者，他想问的是，在中国采取的动态清零政策下，经济由于工厂的关闭和群众长时间的居家受到很大影响。第一个问题是政府如何减少这些经济方面的影响？第二个问题是中国在下一步是否会引入更多的外国研发的疫苗和药物？谢谢。
我来回答一下。首先谢谢这位记者的关注。
Thank you very much.
新冠肺炎疫情发生以来，国
Since
家
the
卫生
start
健
of
康委、国家疾控局、
COVID-19, the National Health Commission and the National Disease Control Administration have implemented the decisions of the CPC Central Committee and the State Council and guided local governments to adopt science-based and targeted approach and prevent case importation and domestic COVID resurgence under the dynamic zero COVID guideline. As the knowledge of the virus deepens, and in light of the changes and real need of COVID response, our anti-COVID measures have been more improved and science-based and targeted. We have entered a dynamic zero COVID stage with whole process and targeted contain and control measures. We have done the following to improve our detection and defense against the virus. The first keyword is prevention. We step up efforts to prevent case importation. We released a notice on strengthening COVID response of port cities. The notice included steps to improve the COVID response mechanisms in port of entries, to improve the pre-warning system and monitoring system of COVID-19, strengthened management control in land and sea border cities, and strengthened personal protection and closed-loop management of high-risk personnel. We also increased the management control of cold chains and improve the disinfection and disposal measures in port of entries of high-risk commodities and the environment. Second keyword is early. We step up efforts on early detection. Measures have been taken to ensure the frequency and health monitoring and also the frequency of nuclear exit tests in port of entries, designated quarantine facilities, and designated hospitals. Fever clinics have been seen as a warning post to make sure that the fever clinic that first receives the patient takes primary responsibility. The procedures of individual clinics and primary level medical institutions have been standardized when they receive fever patients. Third keyword is substantive. We increased our preparedness to handling the virus. All local governments have been asked to establish an emergency response commanding system to deal with normal and emergency situations. On a national level, we set up 16 national epidemiological expert teams. They work in pair with 8 areas across China. And the local governments are also asked to establish sufficient epidemiological teams, including personnel from public health, disease control, public security, and information technology departments. Regular exercises and trainings have been conducted to make sure that they have enough capacity to deal with emergencies. The local governments have also been asked to have enough personnel to deal with sweeping nuclear exit tests. The fourth keyword is rapidity. We step up efforts on treatment in early stages. The 24 hours after a case is detected and tested positive is gold. So once a case is reported, while we advance the work on screening and re-examining the sample of the positive case, we take simultaneous measures to advance epidemiological study, nuclear exit tests, the arrangement of quarantine facilities, and the management of communities. By doing this, we could make sure that we can make synchronized progress of the tests, isolation, treatment, emergency response, and press release. The fourth keyword is strictness. We step up efforts on the management of designated hospitals and hospital-acquired infection control. The management of fever clinics has been improved to make sure that the facilities meet the standards of controlling respiratory infectious diseases. And for those working in the fever clinics that deal with high-risk population like inbound passengers, residents in mid or high-risk areas, or fever patients in designated facilities. These medical staff working in the fever clinics follow strict procedure in accordance with the closed-loop management. And also we increase the screening of medical staff when they enter the isolated areas. Looking ahead, the NHC and the National Administration of Disease Control will conduct regular training and exercise to increase our emergency response levels and strengthen the risk monitoring and screening in key areas. While we implement the above-mentioned measures in detail, we'll also pay attention to an oversimplified implementation of the measures, or arbitrary implementation of the measures. As for the second question about whether China will introduce more foreign-developed vaccines or drugs, you could relay this question to the competent departments. Thank you very much.
好，请继续提问。
Next question, please.
先前面吧，这第二排这位女记者。
China Daily.
The
ninth edition of the treatment protocol for COVID-19 has changed its context from requirement for isolation and health status monitoring for 14 days after discharge to home health monitoring for 7 days after discharge from hospital or quarantine. What is the basis for the amendment?
Thank you for your question. As I mentioned just now, based on our experience and practice, the patients who are recovering from the disease, if their CT level is above 35, their virus cannot be separated from the sample. This shows that they are no longer transmissible. And based on our research of those who retested positive, well, those patients will not cause further spread of the virus. So when those patients' CT level reach 35 or above, they can be discharged from the hospitals. And the second consideration is that in the past, based on our previous experience, those patients will be put under 14 days of quarantine or go to a recovery hospital. Now, those people, instead of being quarantined, can be sent home for home-based health observation, and the period will be shortened from 14 days to 7 days. We have looked into the cases of Delta variants and Omicron variants. When those patients are recovering from the disease, usually within 7 days, they would get fully recovered. So we have shortened the period from 14 days to 7 days. That is also based on our observation and practice of actual cases. That is why we adjusted the period and changed our requirement for quarantine to at-home observation. But for those who stay at home for health observation, they should strictly implement the requirements for health monitoring and observation.
New York Times. Other countries and territories have found that the elderly are the most vulnerable and that the only reliable way to protect them is through vaccination. What percentage of people in China who are 80 or older have had one vaccine, or have had 2 vaccines, or have had 3 vaccines for the coronavirus? And what are you doing to encourage these elderly people to be vaccinated fully if they have not already received 2 or 3 vaccines? Thank you.
好，请翻译一下。
来自《纽约时报》的记者，大家都知道，老年人在疫情面前是非常脆弱的。我们也从其他地方看到，为老年人接种疫苗非常重要。因此，我想问，中国在80岁及以上的人群中有多少人？及中国将采取什么样的措施鼓励老年人接种疫苗？谢谢。
非常关键，一直高度重视。
The Interagency Task Force attaches great importance to the vaccination of the senior citizens, and they have made several special arrangements for the vaccination to the elderly. The local governments have also coordinated to take multiple measures to encourage the elderly to take vaccination. I know you asked about the question for those above 80s, but I have numbers. I would like to introduce to you the numbers between the age group of 60 to 69. By March 17th, 88.8% of population aged between 60 to 69 received first shot of the COVID vaccines. And over 86% have received 2 shots, and over 56% received 3 shots. And For those aged between 70 to 79, the three numbers are 86.1%, 81.7%, and 48.4%.
这个1剂4全程免疫加强针这个比例分别是这3个数字。那么您关心的这个
And for those above 80s,
80岁以上这个是这个最需要保护的。
indeed they are in most need of protection. The three numbers are 58.8% receiving one shot,
是58.8%。那么完成了这个全程免疫的
50.7% receiving 2 shots means fully vaccinated,
做了加强针的
and
是19.7%。
19.7% have received booster shot.
所以总体看来我们这个总的来看就60岁以上，我们有2.64亿人口
And there are about 260 million people above 60.
2亿1176万，2亿1176万，这个完成了全程接种。
220
我们还有5200万
million
这个60岁以上的
have
老年人
received
没有完成全程接
2
种。
shots.
那么其中占比这个占的比例最大的是这个80岁以上的刚刚谈到80岁以上完成全程接种才50.7%。
As I said,
完成加强免疫的
above 80s, only a little bit over half of the population over 80s have been vaccinated. So the vaccination level
这个全程接种
is relatively lower than the other age
对于老
groups.
年人特别是对于高龄老年人是非常有意义非常有价值。
I want to stress once again that vaccination for the elder citizens, especially the people above 80s, is very important because the immunity of this group is relatively lower than the youngsters, and many of the senior citizens have underlying diseases. Once infected, they have higher risk to fall into severe or fatal cases.
那么但是呢重症的人很少
Since last year, there have been multiple clusters of cases in China, but very few of them were
但是在去年
fatal
8月份
cases or severe cases.
就去年8月份
But
杭州
Since August, but in August last year,
里面它是
in
德尔塔
the city of Yangzhou, there were outbreaks caused by
而且
the
这次
Delta
是老
variant.
年人占比很高所以呢
Senior citizens accounted for quite a high percentage
比较多
in the
那么扬州
cases
这
in
次疫情
Yangzhou.
总共有1388例
There
这个
were
感染者
over
那么其中60岁以上的
1,300
老人里面
cases of
这个出现
infection,
了67例重症就是这个
And
因为他老年人多所以
67
出现率也比较高
were above
那
60
么这
and
1388
were
例里
severe
面
cases.
接种的疫苗的全程接种疫苗的
Of
占比是
the
38%。
1,300 cases,
那么
only
67例重症中
38%
65
were
例是
were
没有
fully
接种
vaccinated.
或者没有完成全程接
And
种
of the
60
67
岁以上的
severe cases,
67例重症中
65 of them
65例
were
是没有接种
not vaccinated at all
没有完成
or
全程
not
接种
fully vaccinated.
那么近期的香港这个疫情
Also
大家
in
也
Hong
看到
Kong,
这个报道这
recently
个报道那么接种疫苗者的死亡率是
we noticed that the
0.04%，
mortality rate for the vaccinated
那么没有接种或者是没有
is
完成
only
接种的
as low as 0.04%,
1%
but this number
这个
grows
这个比例
to 1.25% if the infected are
并且
non-vaccinated
香港这次疫情中
and
or
non-fully vaccinated.
90%都是这个
And over 90%
所以从
of
这两个例子
the
可以看出两个问题
mortality
两个问题一个问题是什么呢
population
就是疫苗
are
接种
senior citizens.
对于
The
预防
number
重症预防
proves
死亡
that
是有很好的保护作用
Vaccines is
我们知道在
an effective
扬州
shield
肯定是接
to
种的
keep
是
these
这个
senior citizens away from
这个
infection or
在
even
香港呢
mortality.
是主要是 mRNA 疫苗和这个灭活疫苗这两种疫苗
And in Hong Kong, we
那
know
么各占比大概是
mRNA
60%。
vaccines and inactivated vaccines are
那么第二个问题是
mostly
我
applicable.
们的老年人和有基础疾病的人群是最需要保护的。
And the senior citizens and the people with underlying diseases are the ones that need protection the most and need vaccination the most. So in order to improve to increase the vaccination rate in the next phase, we'll do the following aspects. First, it will help foster a proper understanding of vaccination. We will emphasize the principle of voluntary vaccination. At the same time, we want to tell them that every individual is the primary stakeholder of his own health and life. Against the background of pandemic, vaccination protects individual, protects their family, and protects the whole society. At the same time, we'll actively respond to the issues of interest of the elder citizens. For example, they may wonder, is the vaccines safe? And answer their questions. Some of them may wonder, are there any side effects? Is it effective? Is it safe? How can it protect senior citizens? Will vaccination intensify underlying diseases? And some may say they are quite indoorsy. Is it still necessary for them to receive vaccination? Only if we answer these questions can we encourage them to receive vaccines, and can they be more effective or active to receive inoculations. Also, the data and some basic knowledge about vaccines will be published timely. And we also hope media will invent some popular ways to promote the basic knowledge of vaccination. Second, we attach importance to the role of local governments and communities. The local governments and communities should mobilize the elder citizens and those living in the communities to receive vaccination on an informed consent and voluntary basis. Third is about the requirements for hospitals and health agencies. When giving vaccination to the elder citizens, they should arrange for personnel that is familiar with the physical conditions of the elder citizens to make sure that they can receive health assessment before vaccination and timely observation after vaccination. Fourth is we'll carry out facilitating measures. For example, arranging vaccination trucks to reduce the trouble of travel and waiting time for the elder citizens, and will open green channels and fast tracks for the vaccination of elder citizens. We'll do everything we can to provide convenience for vaccinating the elders. Thank you very much.
好，请继续提问。第一排吧。
谢谢主持人。封面新闻记者提问。
Cover news.
近日，联防联控机制综合组印发文件，在核酸
Recently,
检测
the
基础上增加抗原
Interagency
检
Task
测作
Force
为
issued a
补充。
document
居
to
民自购
add
抗原检测
antigen
产品是
testing
否
as
需
a
要备案？
supplement
如果
to
出现阳性结果不
nucleic
上报的
acid
情况，
testing.
是否有相应
Do
的监
residents
管
need
措
to
施？
file for purchasing their own testing products? Are there any corresponding supervisory measures in case of
好，谢谢您的提
non-reporting
问
of positive
首先呢，
results?
居民
Thank you very much. First, self-purchasing. People, the residents have no need to file for self-purchasing antigen tests. But if the test comes out positive, the residents should immediately report to the communities, and the communities will contact emergency center to transfer the positive cases to medical agencies for further tests. And all provinces have made detailed plans following this general principle. As for the corresponding supervisory measures in case of non-reporting of positive results, actually we have touched upon this topic. As I said, everyone is the primary holder of our own health. So reporting positive case not only protects our family, but also is a way of protecting ourselves. Based on this understanding, we hope or we urge that once tested positive by self-testing, report immediately to the communities. And also China's law on the prevention and control of infectious diseases, there are clear stipulations that everyone has the obligation and responsibility to report positive cases to the government. If the non-reporting has caused the spread of the disease or brought damage to other people or other people's properties and assets, they will be held accountable accordingly. And there have been real cases violating such stipulation. So I want to remind the citizens that if you tested positive by receiving antigen testing, please report immediately. Thank you.
With China News Agency, recently China has seen cases occurring widely and frequently in multiple parts of the country, and there are clusters in more than one province. What advice do you have for the general public to protect themselves? Thank you for that question. I'd love to take your question. I think that personal protection is not only necessary under the severe COVID situation that we face now. I think it is, in fact, necessary throughout the pandemic, even when the cases are not that severe. As Vice Minister Zeng talked about vaccination for senior citizens, I believe the first thing people should do is to get vaccinated and protect themselves. Because the experience we have for containing the pandemic is to cut off the transmission and protect at-risk population, and the most effective way is through vaccination. And based on our experience and practices, the vaccination has really worked, especially for the senior citizens. If we look at the outbreak in Hong Kong, that is a really hard lesson to be learned. If there is low vaccination rate among the senior population, then there will be a high proportion of severe and fatal cases. And I remember there is this question about the vaccination for senior citizens just now. Or some people thought that the old people usually stay at home or at nursing homes. They don't have to get vaccinated, but the difference is really huge for those vaccinated and those unvaccinated, and the outbreak in Hong Kong is a case in point. So we hope that we could all set good examples and encourage our own elder parents to get vaccinated because they need such protection more than anyone. And the outbreak in Hong Kong shows that there is a huge difference between the vaccinated and unvaccinated populations. And for those unvaccinated, they must receive COVID vaccine shots as soon as possible, because the rate of severe cases among the senior population is really high. And our country provides very good vaccination services, and all the relevant departments are working together to ensure sound vaccine rollout. Our relevant authorities have been working on vaccination at nursing homes, including for their residents, and now many senior citizens understand the importance of vaccination and are embracing vaccination. So we hope that the general public will work with the relevant authorities and provide good services for the senior citizens. So I believe we do need to make the most of our vaccination program. And second, we need to ensure good personal hygiene. And I believe everyone understands how important this is. When at home, we need to ensure sound ventilation, disinfection, and good personal hygiene. And during outings, we need to wear our masks, protect ourselves, keep our hands clean, keep a safe distance, and do not go to the crowded areas or gatherings. And third, we need to follow the requirements for COVID response, including cooperate with the epidemiological investigation or testing, especially work with and follow the requirements at the public places and the venues. For example, show your health code, etc. This is in everyone's interest. And in addition, we also need to keep a close eye on one's own health. Once you have a fever or cough, please seek medical attention immediately and report to your communities. So we hope that we could all work together and build a strong line of defense against COVID-19. Thank you, all the speakers, and I'd also like to thank all the journalists. With that, we conclude.